New York prosecutors are seeking to extradite the suspect linked to the killing of an insurance company executive. Luigi Mangione was arrested Monday at a McDonald's in the state of Pennsylvania. That is hundreds of kilometers away from last week's fatal shooting of United Healthcare CEO Brian Thompson. Mangione faces several charges, including murder. Investigators say evidence includes a firearm that is linked to the killing, a fake ID, and a handwritten document, a manifesto, if you will, expressing his ill will toward corporate America. Now, in the days following the shooting, there has been a strong public backlash against U.S. healthcare insurers online. Now, earlier I spoke with Jay Wolfson. Jay Wolfson, he is the Interim Dean of the College of Public Health at the University of South Florida. And we began our discussion making it clear no one knows for certain if indeed healthcare can be directly related to this killing, but violence against any person, no matter what, is unacceptable. And while discussing the comments online, we then talked about the underlying concerns that people have about the current healthcare system in the United States.
Well, thanks so much for having me, and your point is terribly well taken. Violence is never acceptable against individuals who represent organizations who are doing their jobs. He was the CEO of a part of the corporation, and the assassination by whomever did it is intolerable and vile. However, there has been a growing concern, I'd say for the past 25 or 30 years, over the role of what we call financial services corporations in healthcare. These tend to be insurance companies, or we often call them managed care companies, health maintenance organizations. Right. And United is one of the largest in the country. And the concern is that these organizations are using policies to affect who gets care and when they are beneficiaries. So this stuff about denying and delaying care has been an issue for an awfully long time. And it speaks to the fact that these are private, for-profit corporations that are designed to optimize the return on investment to their shareholders, but they've never, in some of our opinions, been really committed to improving the health status, nor access to care, nor outcomes of care.
And also the United States, the largest economy on earth, wants to say we have a wonderful healthcare system here. But facts point to something entirely different. And denial of claims, prior authorization, those terms are really hitting a nerve around the country, and people are having these discussions now. So compare the U.S. health system to other large economies. What are the major differences?
Well, unfortunately, we spend more per capita on nearly every other nation on earth. And if you look at the outcome data in terms of things like maternal mortality, infant mortality, causes of death, diabetes, hypertension, cardiovascular disease, people having difficulty recovering, we have the worst outcomes compared to most other nations on earth, and there's no excuse for that for the amount of money we spend. We like things that are shiny and new and have high technology, but we're not really concerned about promoting personal responsibility and good outcomes for healthcare, good diet, good exercise, quality of care. Rather, there's more of an incentive to optimize the benefits to the providers of care, to the insurance companies, than there are to the individuals in our community who may be in need of care.
Yeah, and look, I read a very sobering opinion article in the New York Times before I came out here from an ER doctor, and I would encourage everyone to find this and read it. It really, I think, cuts to the core of the issue, and it's heartbreaking. A patient in ER chose to go home fearing a massive bill, despite the fact that the attending physician warned him how serious his condition was. It could be fatal. So how have rising costs impacted access to essential care for everyday Americans?
Well, even for people who access care from the Affordable Care Act, which is oftentimes called Obamacare, many of those people still have to pay significant amounts out of pocket for a deductible, which is the amount that you must pay before the insurance policy goes into effect, and for copays, which is a percentage of everything thereafter. And they realize that, and they say, well, I can't afford to get care, so they delay. They delay getting care themselves until they are too sick and wind up in the emergency room sometimes. Or as the case of the emergency room physician who wrote that article, some people are in there and they say, you know something, I'm building up bills that are so high, I don't want the emotional strain, let alone the financial strain of having to deal with this when I get out. So I'm just going to leave and see what happens.
Yeah, Jay, it's staggering the number of people who have to claim bankruptcy because they can't afford. So how can the industry and the government rebuild trust with patients who feel underserved or overcharged? I mean, this is a big mountain, but reform has to start somewhere.
It's huge, and part of it is paying for things that relate to outcome rather than procedures. We still tend to be a very procedure-oriented healthcare reimbursement system. The more you do, the more you get paid, as opposed to here's the outcome that we're looking for, and if you don't achieve that outcome, you don't get paid. And also, there's another big part of this, and that's personal responsibility in our culture. In the American social system, we are much more driven toward immediate responses as opposed to long-term investment in things like our health, our welfare, and our financial security. If we don't get it right away, we're not happy. We want it right now.
Yeah.
And the system doesn't really encourage that, though it should. Take care of yourself, take care of your family,
Yep.
take responsibility for your health.
Okay.
That's a good place to start.